First of all, I want to thank Asuli for the invitation, especially to Bait Al Amanah, especially to partner together with Queet Like Sweden to organize this event. It's such a joy to do this work together, this monumental work, monumental effort that we are all working together for the betterment of our society. Now, on to the slides. Yes, thank you. So what I will do as a moderator is I will just give a bit of preliminary data and statistics. So I'm an economist, so I love data. Numbers don't lie, statisticians may. But what I will do is give you a bit of foundational information about the situation that we have in Malaysia. But right before that, just a very quick introduction to our organization, Bait Al Amanah. We're a think tank just right behind at Binjai 8. We focus on economics and public policy, sustainability, impact, international security, foreign affairs, as well as social policy, human rights. We welcome all forms of collaboration. So those who are outside just now, registering, you can speak to any one of us here to get more information about this. Now, on to what I want to share, the foundational statistics that we're going to explore. Just a bit engaging. How many of you know someone in Malaysia who has died of a smoking-related disease? Can I have a show of hands? Anyone knows anyone, for the matter? Yeah, quite a number, right? So in just a few more moments, we'll take a short 20-minute break. But in that 20-minute break, one Malaysian will die of a smoking-related disease. Just in that 20-minute break, yeah? And that is the situation that we are facing today. Based on the data, 27,000 smoking-related deaths annually just in Malaysia. Well, I'm a very optimistic person, but I know that a pessimist is a well-informed optimist. And so data proves otherwise, that we have to evaluate the situation that we have today and think of how we can make Malaysia and the world a better place. Now, moving on, the government has already, the Ministry of Health in 2011 has already come out with a statistic, the goal, right, to achieve 15% or less smoking prevalence by 2025, I'm sorry, and an end game of 5% by 2040. The question is, are we on track? The latest data, 2023, 19%. Smoke combustible cigarettes, yeah, according to National Health and Morbidity Survey in 2023. Very quickly, if we evaluate this data, break it down a bit by the different use of tobacco, we see that in Malaysia, a lot more are still using conventional cigarettes, smoked cigarettes, 19% compared to just 0.9% of smokeless tobacco use, such as snus, such as snuff, and chewing tobacco. And electronic cigarette use is about 5.8%. Now, this is across adults, men and women overall, yeah? But it's quite different from the Swedish case, where in Malaysia, a lot more men smoke compared to women. Next one. If we do it regionally, smoking prevalence, this is as of 2023, is higher in the East Malaysian states, especially in Sarawak, yeah? It's about 25-26% compared to the other states. Another issue that East Malaysia faces is that 4 out of 5 cigarettes smoked is illegal, or is basically this is through the illegal cigarette study conducted by Nielsen Consumer, where almost it peaked at about 2020 with about 85%, decreased slightly to about 79% as due to several measures done by the government in Budget 2021 initiatives, which were supply side measures to cater to address this high illegal incidence of cigarettes. Moving on, let's focus on adolescents. This was the Adolescent Health Survey 2022. There is a new growing trend where there's a switch in preference for nicotine delivery from combustible cigarettes to e-cigarettes and vape users. It's kind of like a swap where 5 years ago in 2017, from 2022, 13.8% decreased to 6.2%. But in terms of vape and e-cigarette use among adolescents aged 13 to 17, from 9.8 to 14.9. Another interesting finding for this survey is that the prevalence of e-cigarette and vape users has doubled among female adolescents since the year 2017. There's a bit of a concern here. Now, coming to just very quickly on smoking cessation. Is the push for smoking cessation effective? This is based on the GATS survey, or known as Global Adult Tobacco Survey in Malaysia in 2023, where 2 in 5, or 41%, said that they are not interested in quitting smoking. 9% plan to quit smoking within a month, 13% within a year, 37% plan to quit someday. Yeah, someday, yeah. All right, so what's interesting here is that if you compare this with the smoking prevalence, you know that probably a lot of these people plan. But are they successful? Unfortunately, the survey doesn't account for success rate of smoking, those who have quit smoking. Which brings me to the next controversial quote. Good intentions, great for wishful thinking. Is it useful for quitting smoking? Are good intentions sufficient for smoking cessation? You know, that is a question that I want to leave. Before that, what efforts have been smokers using to quit smoking? 70% without external aids. This is trying to quit smoking, not successful yet. 14% by using e-cigarettes or transiting to e-cigarettes. 10% pharmaceutical medications, and 8% through counselling. I think I will not make any judgments here because I'm the moderator. That's my privilege to give you all the statistics. But I think later on, Prof. Sharifah and Prof. Marua will elaborate more on a bit more, giving more insight why this is happening. Now, my final slide before I move to the presenters of today. Should we consider a pragmatic three-prong approach? Yeah, I think Dr. Milton earlier brought up about WHO's 3 pillars that needs to introduce a 4th pillar. And I straight away checked up. The 3rd pillar is about protection. So this three-prong approach is more for those who are already smoking or those who have not smoking. If you smoke, stop. Cessation. Sorry if you can't see the words. That's cessation, the principle of cessation, getting people to stop. If you don't smoke, don't start. That's prevention. At the same time, cessation and prevention has to go hand in hand. We're not saying abandon it, no. But the final one, if you can't stop, for whatever reason, for example, you're making a monotonous job, like my uncles who both passed away, you know, of smoking-related diseases, they were just security guards, and just, you know, you need something, a stimulant to keep you awake through the night, for example. How then can we help this demographic who will probably choose to smoke? For example, a bus driver. Would you rather a bus driver that falls asleep while driving the bus in the midnight, or he's smoking out the window? I mean, or something else that he could use as a form of harm reduction, for example. So that is the 3rd prong that is very much missing in our Malaysian policy thus far. Yeah, so something to leave the thought to leave with all of you before I invite our speakers. Something to think about. So thank you so much for the time for me to just a very short presentation. That is our address, that's our email. You can always contact us if you want any information or anything.